I'm Madge Vasquez, and I serve as the Director of Dental Operations for the St. David's Foundation. And our mission is to help eradicate childhood dental disease in Central Texas. We do that by providing free dental care to children, elementary children, in Title I schools in Central Texas across 6 school districts that span 3 counties. For our population, as I mentioned, we focus on children in Title I schools across 6 school districts, which include, and I've got a staff member here, our operations manager, Jesse.
And
so
you chime in
yeah,
anytime.
so if I leave anyone out. So we serve Del Valle, Hayes, Manor, Austin ISD, Round Rock, and Pflugerville. Did I get them all? And within that span of 6 school districts, there are 88 Title I elementary schools. Our capacity at the St. David's Dental Program is we've got 6 mobile units that have 2 operatories each, so 2 dentists and fully paid staff, dental assistants. So those 6 are trying to serve 6 school districts with 88 schools. So when we talk about the need is tremendous, and the capacity is limited, and so that's just one of the daily kinds of challenges. And because we focus on low-income children, that target population has an overwhelming need and many times has gone without dental care for years, since from infancy to now they're seeing their first dentist and they're in the 2nd grade.
Victor Acios with El Buen Samaritano Episcopal Mission, if you want the full name. Our focus are, primary needs, everything from food pantry to the primary needs, health needs of individuals and young people. So we have a childhood learning center there, along with educational needs for adults and some youth with after-school programming. Our health clinic has been in operation over 20 years. It's been run primarily with volunteer physicians. This is our first year with volunteer physicians and a full-time physician, so we're growing. We've also added a nutritionist to our staff. Yes, we do need more physicians, more nurses and nurse practitioners and all that, but we also need more community-based individuals like promotoras, like community navigators, like community health workers, because we're going to have to flip how we do this work. And the more information we give out in the beginning, the more we build networks so that people can have adequate information and support while they're going through this. And I think that's the paraprofessional layer of what you're talking about, that we need to build concurrently.
Deanna Resnick with Seton Family of Hospitals. Seton Family of Hospitals has always been about 100% access to care. So we operate in 3 buckets primarily. We have a series of programs which we call direct services, things like the Seton Community Health Centers, the mobile mammography vans, the medical children's vans that go in the schools. This idea of pre-existing conditions needs to go away, so you really want to look for plans that let you continue to, just doesn't make any sense that once you're diagnosed with something, then you can't be insured.
And I put that under access.
So,
Because
okay, so
it's
that's under
just-
access. And then prevention, watch to see that there's enough, we already are in a system where the money follows the most sick, and you've heard a lot about that. So you want to see that the money is incenting every one of us have a responsibility and a role for self-care, for accessing the things that we can do to keep ourselves well.
Peoples has been serving really the entire Central Texas region for much of its history. And so more than, I think you said 170 some odd? 72. There are really 250,000 in the Central Texas region who are uninsured. We also include people who are underserved in our definition, because it's one thing to have no insurance. Many people have some form of governmental payment, but most providers, most physicians don't accept that. In Travis County, only 20% of the physicians accept Medicaid or Medicare. And that's because the reimbursement rates are below the actual cost of the service. And so that's something you should be thinking about and be aware of in the whole conversation about healthcare reform now that's taking place. But that's just one example of the benefit of high-quality care. The cost of prematurity is very high. One NICU birth can be hundreds of thousands of dollars, and if that's to an uninsured person, the mother, the baby would likely be covered by Medicaid, so that's a cost that we all eventually share in some way. Prevention of any one thing doesn't necessarily hold down all the future costs, and so it's how do you determine that? But I think there are some areas where it's pretty clear that the value of prevention can't be disputed.